Hi, everybody.
Heyo!
It's Leanne Scott
And Dale Fuhr.
from MOVE Therapies in Osoyoos, British Columbia, Canada. Go ahead, Dale.
Today we're here to talk more about fibromyalgia. We've had a number of clients that have come in and we just want to share some of their stories.
Yeah, we've already done one video about fibromyalgia, just sort of laying out some of the symptomologies and asking questions about people who have experienced it. And today we want to dig a little bit deeper into that. So speaking of symptomology, let's just review that really quick for either to dig deeper. A lot of our clients have come in and they've had vastly different symptomology when it comes to their fibromyalgia. The first ones that popped to the top of my head is we had one client that came and she had a very all over her whole body from top to bottom, terrible ache. And sometimes ache comes across as like, no, I mean a terrible ache, almost like very much to the touch. And then we had another client come in that had not an ache, but very localized, not all over, very localized, but sharp, burning, stabbing pain. We also had one woman come in that was environmentally challenged when it came to her fibromyalgia. She was very affected by the environment. So it's a very complex condition, and it can make for a very difficult diagnosis.
Yeah,
unfortunately.
And that's usually been the story for most symptoms that we've worked with. Is it's usually how long does it take you to get a diagnosis? For some,
or even to get help,
Yeah.
It's or believed,
especially with fibromyalgia. There's no, from what we know, there's no one test that tells you if you have fibromyalgia.
Yeah,
it seems to involve some kind of blood work, from what we've seen. And usually it takes forever to get done.
Yeah.
And in that time period, the belief of do you actually have something comes up again and again. Because I think from what we heard from our clients is they're going to the doctor, okay, I'll send you for another test, and then go to the doctor again, send you for another test. And that process could take 6 months to like 3 years. It's some of our clients, and then in that time period, they're obviously living their life and
generally, unfortunately, usually getting worse.
Yeah.
So, that's a terrible thing to go into the doctors 4 months after you saw them, after you've had some tests, and then you come back and you're like, no, it's not any better. In fact, it's way worse. And then when you come home and it's sort of vague answers again, it's really tough. It's really tough on the person, and it's really tough on the families.
Yeah, a lot of times it's again, I can't imagine. This is, I think you had sort of some symptomologies at some point.
I did, from actually a tick bite.
Yeah, from a tick bite, and it was just an overall body ache. I remember if I just brushed up against her shoulder,
it would kill me.
Thankfully, that only had a limited time period of how long it lasted,
and it was 6 months, and that felt like a lifetime.
And
the guilt. Yeah. I mean, the guilt from the person that has it, because all of a sudden, their household duties, they slow down on if they're raising children, all of a sudden, more of the raising of the child goes on to the other partner because the other person is in so much pain. So it filters into a lot of different parts of their life.
Yeah. And it's so different. You break your arm or something, everyone else around you can see, oh, I've broken my arm.
Yeah.
I can see we need to do something, put a cast on it. We have some painkillers that work with this. It seems that with fibromyalgia, we've had mixed results in terms of how people were, usually it's some type of painkiller or even an antidepressant. Gabapentin seems to be the one.
It does seem to be the go-to that a lot of our patients have been given. And the unfortunate thing that we found with gabapentin is it seems to work incredibly well for some people. They take their first dose, and within a very short period of time, they feel, maybe it's not all gone, but they feel significant relief. But unfortunately, it also, I've heard from numerous people that it has done nothing. And that's a terrible feeling when you've been told, okay, we're going to give you a drug. We don't really know what you have, but obviously this is bad. Here's the prescription for nerve pain, which is what you have. And they're on it weeks and they felt zero difference. And it's scary as well, because then they think, well, this is the only thing that's out there and it doesn't work for me.
Yes.
And I'm not saying there's nothing wrong with gabapentin in that way. It just seems to work. It's very profitable for some people and not very profitable for others.
Yeah, I can take ibuprofen.
Yeah.
Leanne can't. It doesn't really
He
affect
takes
her.
like a half an ibuprofen and he's like, oh, better. Meanwhile, I'm like, no, it has done nothing. So yeah, it is unfortunate, and I have noticed that a lot with gabapentin, that it's great for some people and nothing for others. We have also been told that some people were told that they should do therapy, and usually it's an occupational therapist or an OT. And what the few people that have done that before they've come to see us, I've said, what did that entail? And a lot of times it entailed, I use the word external tool. So their workspace will be changed to make it better ergonomic, which is smart, but it makes it easier. It's something external that is added to their work or life, that makes it easier to do what they need to do because this pain is not going anywhere. And that can be great for a short amount of time, or it can be great for a bit, but it's still there.
That's right.
Yeah, so
it doesn't
that
take care of the symptoms.
Yeah, it doesn't take care of the symptoms, and that's what most people are looking for.
And usually, and the good thing, like what we do at MOVE Therapies, we do call our method, so they are not Benil method.
Mm-hmm.
It is a pain-free method in the sense of when we touch someone, if they come in at a level 5 pain, we're not going to go above that 5 pain. Hopefully in the lesson or in the session, it'll go below that 5 pain and not go above it. Now, so working with someone with fibromyalgia, we're touching them very gently, can be very painful. This method can be very effective.
Yeah, because if you come in and your whole body is on fire, I remember what it was like when I had my tick. Touching me, literally, even just touching the skin can be incredibly painful. So doing traditional therapies, which are, can be exercisey, can be like, well, I can't do that. It hurts too much. So that is one very, very nice, because it is very gentle, because it is very subtle, because it's a learning based modality. You're not just being told to do reps. More people with extreme pain, we find, are able to do this therapy and participate in the therapy that we do here at MOVE Therapies easier and better, so thus they have longer term and better outcomes.
Yeah, especially for someone, fibromyalgia. Like we've had, the one lady, when she was done, we have her video below, she was literally dancing out of our clinic, which isn't, I thought that was going to be uncommon for us to see that, but it's not that uncommon for people to dance out of our clinic, which is fantastic.
Trust me, when you watch the video, because we did little clips of it, it's only about 30 seconds, you'll see how she moved when she came in to dancing out of the clinic is a very big deal, because hers actually, interestingly enough, was very painful, but it affected her mobility more than it actually caused her pain. She literally was like, I can't walk very well, I can't put my foot down and that. So it's a wide range of symptoms, and it's really life debilitating. And like we said, because it's difficult to diagnose, because it's very fatiguing. It's incredibly fatiguing, because it's hard to be believed. It comes with a whole bunch of scope. In fact, general counseling is also very, very much requested by physicians for people that struggle with this kind of condition, because it's tough. It's tough on your relationships. It's tough on your life. Is this what my life is going to be forever and ever? It's a biggie on top of the huge pain.
It's one of the more, I would say, complicated things that we've worked with. So.
But we've had wonderful outcomes.
We've had wonderful outcomes.
That's why we wanted to talk
include
to you about
our testimonials below there. If you're interested in learning more about what we do, we have our website link below. And if you have any questions, feel free to post them below. We'll be more than happy to answer.
Yeah, absolutely. Or if you wanted to just call in and ask. Or one thing that did happen with video 1 is people put on Facebook, they put shared friends' names directly to it, because people know around you it's a toughie. So if you want to share it with somebody, this video, please do, or ask any questions you feel that you'd like. We'd be more than happy to respond. So it's Leanne Scott,
Dale Fear,
from MOVE Therapies in Osoyoos, British Columbia, Canada. Thanks so much, guys. Hope to talk to you soon. Bye-bye.
Bye.